Hi, everyone. Happy Juneteenth. Welcome to Hey Cuz. I'm Candis.
And I'm Colette, and today is World Sickle Cell Day. And because of that, I want to share some light on that, with Candice being, of course, a person that has been going through sickle cell. And I just wanted you to hear a little bit more about that from her perspective. And I'll ask her some questions. And of course, you guys are free to always comment later on when we post. So, first, let's
I'm an
start off with
open
our
book,
t
I
shirt.
guess. Well,
Let's talk
firstly, I
about
want to
that.
say we missed you guys. We've been gone for a few weeks, but that's on me. And that brings us back to the sickle cell awareness day. I was actually sick. So we weren't able to record. I missed you guys, and I'm happy to be back. So take it away.
All right. What are you wearing? What's that on your
I am wearing the latest. No, I'm kidding. This is a t-shirt. It has. We've been trying to design the sickle cell ribbon. Really, the color is burgundy. That's the official color, I believe. But I like this one because it actually shows what the sickle cells look like, and it says "Join the fight against sickle cell disease." But your shirt is cooler than mine. What does your shirt say? You got a better collection than me. But I'm like, you know what? This is my life. I don't need a t-shirt.
I walk every year, obviously for my cousins. So this one says, support the fighters, admire the survivors, and honor the taken. And this is from the branch that's here in Texas. So it has a
That's
ribbon
nice.
on it as well.
I like it.
And I also have a shirt with my cousin's face on it, but I couldn't find it today. But that's usually my favorite thing too.
Colette has always been our biggest supporter, so we appreciate you for that and for always spreading awareness and education and stuff. So thank you for that. I volunteered. We'll see how I feel about it later, but I told Colette she can ask me whatever she wants. So let's do it.
All right, all right. So for those that are watching or gonna be watching, can you just give a brief overview? What is sickle cell?
Sickle cell disease is a genetic blood disorder that causes the cells to be shaped as the garden tool called a sickle, which is C-shaped, or it looks like a crescent moon. So that's where it gets its name. It's actually the most common genetic blood disorder ever, which is interesting, seeing as the awareness isn't as great. Even though it's more common, it's very common and more common than other diseases that get more awareness and promotion, hence why we're here. So sickle cell is a blood disorder, and being a blood disorder, it can impact any part of the body because, of course, blood goes everywhere. The main symptom and presentation of sickle cell is called a crisis, and that's where you can have severe pain in different parts of your body. So that's the most common thing presenting, but you basically can wreak havoc on your body because blood goes everywhere. People could have, they generally have spleen. They have the spleen taken out. You can go blind, deaf. You could have stroke. You have heart attack, liver failure, kidney disease, all types of things. So it's very serious. And that's why I'm here, because it's a passion of mine, especially as a healthcare worker, to bring awareness and educate so people can take this disease more seriously. And we'll have less people dying unnecessarily. We out here trying to fight. We out here trying to live. So pay attention. We out here. We want to let you know what's going on.
Yes. So you've obviously you already said that you were in a crisis. That's why you missed a couple. Has anything differed? Are the crises always similar in terms of how you present symptom-wise for you, or is it different depending on time of the year, or just when it hits you? Do you feel different things? Are you always hospitalized? Like what goes on when you go through a crisis?
My pain crises, when I was younger, I feel like it was always similar. Like my back would always hurt. Like it was always my back for sure. And then sometimes maybe my other joints would hurt. Now that I'm older, I always say like sickle cell is like a Pokemon. That thing is evolving, and it's like I can't predict it. I can't keep up with it at this point. So at this point, like the crises kind of all feel different to me. They'll be in different locations. Like sometimes it'll be everywhere. My whole body will hurt, or sometimes the pain concentrates in one area. This past one was kind of crazy. It hit me out of nowhere. I was fine. I felt fine. And I ended up in the hospital. I had pneumonia and acute chest syndrome. So it affected my lungs. And I was having a hard time breathing. So that was my last crisis. So like I said, it can present differently. So now, like, as I'm older, my experience has been like they're just different every time. And no, I don't always have to go to the hospital, but at the same time, I'm pretty stubborn. So I don't like going to the hospital. So I do try to treat myself at home by, staying hydrated, heating pads, warm baths, pain medicine, whatever is necessary. But if I do need to go to the hospital, which last time, I mean, I'm stubborn, but not stupid. So when, get that chest pain, that is an emergency. So I did go to the hospital for that one. And that's when they told me that I had pneumonia and acute chest syndrome. So I usually am in the hospital these days, once, maybe twice a year. Crises for me definitely are triggered more for the weather, colder weather, rainy weather. My friends always laugh at me. They already know I'm not going to go outside if it's raining. It's very unlikely you're going to catch me out. So that's just me. I mean, it's important to know your triggers. And so I always keep a hoodie with me. My jacket lives in my car just in case I need it, because I'm not trying to be in pain necessarily. If I know the cold, being in the cold, like AC, that's going to make me hurt, I'm going to wear a sweater, and I don't care if it's 9 degrees outside.
That's fair. That's fair. You being a nurse, so you've obviously been in the patient role of it. Do you also get patients that have sickle cell? And then so how do you treat them? Is it, I go through this, therefore I know that this is what they're going through, and I know that this is what's going to work? Or is it you treat everything based on that individual? Are you more empathetic because that you have sickle cell as well? Or are you more like they need to toughen it up because I toughen up when I can? Tell me a little bit about that.
I like these questions. These are real hard, heavy hitting questions. Yeah, as a healthcare provider, when I first started working, I was just in a place in my life. I didn't tell anyone I had sickle cell, and I just never really did it in general, because I'm like, it's not important, and I don't want people to look at me differently. So I never really spoke about it, until one time I was just getting sick a lot, and I was just disappearing, and everybody thought I was pregnant. So I had to, tell them. When a woman goes missing at work, they automatically assume she's pregnant. So I had to tell them, no, I'm not pregnant, but this is why, and this is what was going on. So people didn't really know I had sickle cell in my job for years. As a nurse with my sickle cell patients, it's weird because I feel like I was a magnet. Because in the ER, you get your patients are assigned randomly, but I did see a lot of sickle cell patients. I generally don't disclose that unless I feel in my heart that maybe it might, if it's gonna change, sometimes in your heart if someone needs to hear something. So I will discuss if I feel that, but 9 times out of 10, I mean, I separate the two because this is my job and it's my profession. I take it seriously. I treat all my patients with care and respect. So that's how I treat the sickle cell patients as well. And I treat every person individually, whatever patient presents to me, ask who I'm treating. I'm not treating. And that's what I've had to share that with my coworkers. And part of living with sickle cell as a healthcare provider, my life is advocacy in and of itself. Just being there. And I've shared with some of them my stories, and I've been able to change their perceptions on certain things. And I always tell people, you treat your patient. You don't treat a disease. You don't treat a diagnosis. You treat the person that's in front of you, period. And that's with any patient.
Okay. Yeah. Knowing what works for you when you do get sick, and just knowing about the disease in general, when you do end up in a crisis and you have to go to the hospital, do you feel like you as a patient get treated with the same respect that you give your patients as a nurse?
Absolutely not. I
So
was
I'm
just
mad.
talking to my big sis about my last experience. She was like, "Oh, girl, no." I've had some amazing nurses, but as many sickle cell patients know, our biggest battle is fought in the emergency room, because there's a stigma and stereotype around sickle cell patients that say that they are drug seeking, which is fascinating because research shows that it's less than 1 to 2% of sickle cell patients are addicts or display drug seeking behaviors. So it's like, why do you continue to treat us like that if that's not what the research states? And there are also patients with other chronic illnesses that need pain medicine. But why is it that we are the ones that get disrespected the most? My theory is that most patients with sickle cell are people of color. All patients with sickle cell are not. There are people Mediterranean descent, Jewish descent who have sickle cell, but they are the minority. And in the United States, in cities, especially heavily populated cities, majority of sickle cell patients are people of color. So that's where you have the racial disparities in healthcare coming back to bite us. So it's a twofold issue. Even as a healthcare provider, I have trouble, but at the same time, I don't disclose that I'm a healthcare provider. Usually they figure it out, but I shouldn't have to tell you that to get treated, appropriately. You should just do your job. Like I said, I treat my patient, I treat who's in front of me. And what's important about that is there's the term sickler, which I hate because that groups people, and you can't treat one with any patient. I will say it's 10 times, treat your patient, you don't treat a diagnosis. Every person's different. Just because we all have sickle cell, we're all different. We all present differently. You can't treat me how you're treating your patient in room 10 who has sickle cell. I'm not that person. I'm Candis. And I need to be treated how Candis needs to be treated and my plan of care. So that's what's so dangerous in having sickle cell. And I say I'm like a victim of the healthcare system. I'm attached to the healthcare system, and I forever will be until there's a cure. It's unfortunate, but that's my life. So I do need to feel like I should be able to trust healthcare providers. And I honestly, I don't. I'm scared every time I have to go in the ER because you never know. Like, you never know what's going to happen. You might get a good doctor or a good nurse, you might not. It shouldn't be a question mark. And people are dying because of the neglect and the lack of treatment and the disrespect. And it's just inappropriate. This is your profession. This is your job. Do your job. Treat the patient that's in front of you. You can't treat a person based off stereotypes. But that's the world we live in. And, we can't not discuss that. It needs to be addressed because it's a huge problem. So I hate the term sickler. I've addressed this with my own coworkers because I remember one time before I even told people I had sickle cell, they were standing around having a conversation, and I'm just listening to all the stuff that they're saying. And and it's this type of situation has happened many times. And eventually I was like, you know what? Maybe it's my purpose for being here to be an agent of change. I have to, be vulnerable for once, let my guard down, because me saying on privateness on their business is not helping anyone. So I then had to volunteer and say, hey, I have sickle cell. I don't agree with what you're saying, this, that, and the third. And I did sit down with quite a few of my coworkers, and I had to break it down for them. And a lot of them did say that they learned a lot from from what I said, and a lot from my experience, and I've changed their mind on certain things. So, education and advocacy is very important. And I had to learn that lesson for myself because, like, I was being selfish, basically. Keeping my story to myself was being selfish, because if I didn't speak up, then there would be a lot of people who have that same mindset, and it will be a barrier to treating sickle cell patients appropriately. So I always, anytime I hear somebody saying something that's not true, I correct them, because it's not fair to the next person that's going to come in the door.
That's good. I know that you wrote a book and you had a poem in there.
Don't do that.
No. I'm not gonna have you read it. I know that that was your one poem that you said that you wrote and you got out everything. What made you go, you know what, I just need to get this out on paper. I need to publish it. And why just the one?
it was very difficult for me because, like I say all the time, vulnerability is not my strong points. And having sickle cell, I struggle with being viewed as weak or less than, and I don't want people to look at me that way. But I had to learn the lesson that there's a purpose in my pain, and my story could be the thing that changes or saves someone's life. So I had to get over myself, basically. I'm a writer, so I get my feelings out. I have written other pieces about sickle cell. They weren't good because I just wasn't I wasn't being honest, I guess, with myself. So I have little bits here, little bits there, a little bit there, but that was the one. And chances are it will be the one forever. Because I'm like, I don't want to keep beating this horse, It is what it is. This is my life. I have to live with it every day. I don't want to talk about it all the time. So I'm an artist. I can write about a million things. So that's why I decided this was going to be it. I let it all out. I said everything I need to say. And it's beautiful. And that's it. I put it out in the world. I mean, it scared me, but it needed to be said. And I'm glad I did it, because there are many people who have told me how it has impacted them and it touched them and, helped them understand. So I don't regret it. I'll say that. It still gives me anxiety. Every time I recite it or perform it, I get nervous. It's a sensitive topic for me. But like I said, I have to get out of my own way. I have to get over myself, because it's not about me in the end. And I realized that years ago. And I even if I have to remind myself every day, it's not about me. It's about the other people out there who this can help. It's about changing mindsets and helping people have a positive outlook, and inspiring people and inspire the people who need to inspire, advocate for the people who need to be advocated for, educating the people who need to be educated. So that's what that was for.
Nice. So how important is support for you, not just family, but friends and so forth like that? And what would you say to someone who goes, you know what, I want to support this cause? What can they do? What are some things that they can do to help out?
Support is important. If you're a healthcare worker, get into your facilities and educate your coworkers. That's a good place to start. It's hard to create change. If you work in, the C-suites, if you're an executive at a hospital, policies and procedures need to be created. Protocols need to be created. If you're a doctor, nurse, you work in an emergency room, protocols need to be created so there's a streamlined process to treat sickle cell patients when they come into your facility. And it's infuriating because there are a lot of young people with sickle cell who are dying, and I honestly do believe that they are dying unnecessarily. People just need to care more. It's ridiculous. I should not have to go to an ER and fear for my life. Even as someone who is educated and someone who's a healthcare provider herself, as a patient, I am still scared. So I could only imagine for the patients who don't have as much knowledge, who don't have the voice to advocate themselves. I could not even imagine how they feel if that's how I feel. Yeah. So support is very important. Families and friends, being there for, whoever it is, your loved one that may have sickle cell, just being there for them, supporting them, having their back, showing up when they need you, not condemning them if they don't tell you that they're sick, because I have that problem a lot. I have a bad habit of not telling me.
Oh God.
But think of it from my perspective. And I had to break this down for one of my friends because he got mad at me the other day. And I was like, think about it this way. If I'm in the ER, I'm in pain. In this instance, I could barely breathe. Literally, in my mind, I was meditating and I was just trying not to die. Like, it was that serious. So no, the first thing on my mind is not to text you. It's not personal. Sometimes it is pride. I just don't want to tell people. Yeah, I'm gonna be keeping a buck with you. Sometimes I just don't. I just get sick of having to tell people I'm in the hospital. Like really, like it's weird. I don't know, but other times it's just like my mind is not even thinking that. I don't even have the capacity to think that far.
Right.
I'm just in. It was good enough that I got myself there. You know. So give us grace. It's not personal, and just be there. If you're a true friend, you can be mad at me for 10 seconds, we'll laugh about it. But at the end of the day, I mean, really, are you gonna be there? Or you're not. I have some amazing friends. One of my friends drove me to the hospital. I have a friend that she snuck into my room multiple times when I was sleeping, dropped me off meals, breakfast, lunch, and dinner. So it's the little things that you take for granted that matter. Showing up matters. Being there matters. Being on the text, being on the phone line matters. People tried to call me, but I couldn't really speak, so they understood that. They would text me, and they would try not to keep me on the phone too long. But sending somebody some Uber Eats, because when I got home, I could barely walk from my bedroom to the living room. So everybody knows I love to cook, but ain't no cooking. It was gonna go down. But Candis still needs a meal, so send me one on the Uber Eats or the Postmates, y'all. For real, because I still haven't cooked anything since I've been home. So if y'all want to Uber Eats me or Postmates me, Grubhub me, Seamless, whichever, whatever, hit me up because I need to be. I need to get my strength back. I just had to throw it out there. But yeah, that's a good way to support people. Send them a meal. Hospital food is, no shade, no tea, no shade. But it's not the best. And for people who need nourishment, because your body needs nourishment to heal itself, send your friend a meal. That's a good way to show up. That's a consistent and easy way to support, honestly. But on a grander scale, if you want to support, you could research advocacy groups in your city. If you live in a major city, chances are there is one. I live in Atlanta, so we have Sickle Cell Foundation of Georgia. You have one. You know what it's called?
Right here, my shirt. The Sickle Cell Association of Texas, Mark Thomas Foundation.
Yeah, so most major cities and states have one. I know in New York there was a Sickle Cell Thalassemia Patient Network. In New York City, there's a Sickle Cell Sickle Cell Association, Sickle Cell Disease Association of America, SCDAA. Sickle Cell Speaks, that's an organization I've been working with. By the way, we had a poetry contest, so you can find it on Facebook. It'll be airing today, I believe, at 4. So Sickle Cell Speaks on Facebook. There are organizations. If you type in Sickle Cell in your city, chances are you'll find one. You can donate money. You can donate your time. You can go visit people in the hospital. Like I said, provide meals. People take that so for granted, but it's important. When you have a loved one in the hospital, oftentimes they have family members staying with them. Those people, they're already uncomfortable sleeping on the cot. A warm meal can lift anybody's spirit. Food touches the soul. So that's a really important way to give back. There's always events going on. Blood drives, very important, especially as people of color. A lot of people of color do not donate blood, but we are on the receiving end and we need it. So as they're having, I can't remember what the number is at this point, it's over 100,000 people. And they've been saying that figure for years. So I'm sure it's way higher. So way over 100,000 people in the United States live with sickle cell disease. So we need people to donate blood because that is a life-saving measure in the treatment plan for sickle cell disease. So we do need people to donate blood. So donate blood. Find out where you can donate some blood.
I like it. Well, you heard it from Candis. She gave you all the info. Those are my questions. Thank you so much for sharing your time on a topic that I know is very, very vulnerable for you. But I know you've been doing a great job in speaking out more and advocating. So I definitely appreciate doing this, and I hope that you guys that are watching get involved with it. Get involved.
Absolutely.
It affects us, and whether or not you have the disease, it still affects us. Also, get tested. You want to talk a little
Yes.
about that? Get
Yeah, get tested. Yep, you can get screened. There's places, like I said, the foundation, reach out to a foundation that's in your city, or there are testing sites in your city where you can get screened to see if you carry the traits,
Mhm.
because that is very common. I was reading a statistic, I think it's over 1 million people in the United States have sickle cell trait. A lot of them don't know. And if you don't know, that's how you end up with people who have sickle cell disease, because two people with the trait, they let me not get into the math because I don't want to give y'all no wrong statistics.
It increases the chances. So
It increases the chances of you having a child. Let's keep it vague, okay? It increases the chances of you having a child with sickle cell disease. So, like Colette said, thank you for bringing that up. It's very important to get screened to see if you have the sickle cell trait or if you have sickle cell disease, because there's people out there who don't know that either. I mean, in this day and age, it is common to screen at, the newborn screening. But I don't know, maybe it falls to the cracks. I don't know how that works. It's not my department. So get screened, get tested.
And last one, I know I kept saying last one, but if someone does have a sickle cell trait, are they symptomatic at all? Or is it just I have this trait?
They can be. Many people aren't, and many people go through their lives not knowing. That's how they end up with kids who have sickle cell, and they're completely shocked. But there are people who can have symptoms. Usually, the symptoms come when they're in extreme situation, extreme heat, extreme cold, high altitudes. Because I know there was like a football player or something who has sickle cell trait, and he couldn't play like places like Denver. I did visit Denver before, and that will probably be the last time. No need to get into it, but that high altitude is no joke. I tested it out. They say taste and see. I tasted, I saw, and I realized I don't need to head back there. So, yeah. So people with the trait, if they are in extreme situations, they may present with similar symptoms as people who have sickle cell disease.
Okay. Well, you guys heard it. Go see if you have the trait or not. It's very important, especially if you are dating someone, you want to have kids, you want to know whether or not that person has the trait too. You want to know whether or not your kid is going to be at increased risk for possibly having sickle cell disease. Nothing's wrong with having a disease and living a life, but at the end of the day, you still want to make sure what your chances are, what that looks like.
And I mean, going into it, with the more you know, they say. So the more information you have, the more you'll know how to proceed. If you could avoid having a child with sickle cell, I feel like that would be preferable in my personal experience.
Yeah.
I feel very strongly about these things. I'm not going to get into it too deeply, but yeah, like you said, if you're dating someone with the intent of marriage, or if you're not dating someone with the intent of marriage and you're having unprotected sex, you should still find out, because we know what unprotected sex can lead to, a child. So it will be very useful to know that information, what the chances are, what the odds are. So it's one thing to have an unexpected baby. It's a whole other thing to have an unexpected baby who has sickle cell disease. So moral of the story, educate, advocate, get tested, give blood. That's some of my story.
Show up.
We can go into more of it another day when I'm more mentally prepared for it. But y'all can always reach out to me. You can follow me on Facebook at IMC Saint. If you have any questions, I'm an open book. I'm more than willing to share my story, share my experience, come speak at any events that you may have. Just answer, if you're curious, you have questions, I can answer them for you. So thank you for your time. This is World Sickle Cell Day on Hey Cuz. It's a little short, little scratch the surface so you can kind of understand a little bit more about sickle cell and how it works and what happens. Thank you for listening. Peace and love as always. This is Hey Cuz. Have a happy Sickle Cell Day, a happy Juneteenth. We love you. Peace out.
Bye, guys.